In this video, I'm going to be talking about lumbago and its treatment. The word lumbago refers to pain in the lower back. It is not a disease by itself but a symptom, because low back pain can be caused by a variety of factors. The most common cause of lumbago is actually tightness or spasm of the muscles of the lower back. When we are sitting in a posture that is not very conducive, which is not well balanced, and in the same posture over a long period of time, it can lead to stress to the muscles that are supporting the vertebrae and the structures of the back, and that can lead to strain of those muscles, which leads to back pain, which is called as lumbago. So the most common cause of lumbago is of muscular origin, where the muscles are subjected to strain. It can also happen that suddenly the body is subjected to a jerk, as in the case of a jerk during a travel, which can lead to minor tears in the muscles or in the tendons and ligaments that support the structures of the back. This can be another cause of lumbago. So these two conditions which cause lumbago are very often self-limiting, meaning they will automatically get corrected over a period of time, say a week or so. Most cases of lumbago spontaneously resolve within a period of 1 to 2 months. That is the maximum duration. But there are causes of lumbago that are more intense, like what happens in the case of disc prolapse, or there could be facet arthropathy, or there could be a ligamental hypertrophy, which can result in low back pain as well. So lumbago that is caused by these conditions tend to be going on for a much longer period of time, and they are the causes of quite a bit of decrease in the quality of life of people. Modern approach to treatment of lumbago again is based on the type of condition that is causing the problem. If it is just a strain to the muscles and all that, just relaxation, physiotherapy, painkillers are the things that are used. Whereas in the case of a prolapsed disc, which results in pain not only in the back, which also radiates to the legs and to the thighs, very often just pain medication is not sufficient, and sometimes patients are advised to undergo either epidural injections or spinal surgery to overcome chronic cases of lumbago. When we look at the Ayurvedic approach to treatment of lumbago, Ayurveda has very good treatments in the form of external oils as well as certain internal medicines which can help to relieve lumbago that is due to muscular pain, due to small strain and sprains and so on and so forth. We also have very effective treatment for the more severe types of lumbago which are persistent or chronic lumbago, even those bordering on sciatica as well as in lumbar radiculopathy, which leads to numbness and weakness in the legs and so on and so forth. So even in those cases which are associated with lumbago, Ayurvedic treatment comprising of internal medicines, we also have these external therapies called Pudikiri, Elakiri, Navarakiri, Tailadhara, Kadivasti and so on and so forth, along with the most important treatment called as Vasti. This combination of therapies which are individualized to each patient is able to give a very protracted relief to the patients who are suffering from chronic lumbago as well. In addition to that, we at AVN Arogya have proprietary medicines that are extremely helpful in the treatment of these diseases and have fine-tuned the methods of combining Ayurvedic therapies along with physiotherapy to yield very effective treatment over a very short period of time. Very severe cases that have been told that surgery is inevitable for their relief are finding excellent relief within a couple of weeks of treatment at our Ayurvedic hospital setting. Most of the patients suffering from lumbago can even get benefited by just taking the Ayurvedic medicines that we have to offer, along with some exercises that we would advise them to do, as well as to take care of their posture. It is the very few patients who have a very severe intensity of the problem that require either therapeutic interventions at the clinics or who need to get admitted at our hospital for more intense management.
Go here to subscribe.